common myth or misconception that we receive about GLP-1s is patients say that this should be their monotherapy for getting pregnant. They think it's a panacea or a wonder drug. And patients say, look, I know you're a fertility doctor, and I know the script is yet to be written about GLP-1s, but I want to do a 1-year trial of GLP-1s. And if the side effect is that I feel skinny, that's okay, but I really don't want to take anything else. And at that point, we have to counsel patients to understand that GLP-1s are not a fertility drug. They might be an adjuvant for someone's fertility journey. They might be an additive for helping someone get to where they need to go. And they might be a nice to have for the patient who's trying to lose a little extra weight, but has some struggle with actually getting that weight off.
The reality is taking these medications can improve fertility in some cases, but can also reduce fertility in others. It just depends on the clinical scenario. If you're taking oral contraceptives, there could be some interference there that reduces the efficacy of your hormonal birth control. If you're dealing with overweight and obesity that's causing ovulatory dysfunction, then it can help resume normal ovulatory patterns so that you can more predictably conceive. But on the flip side of that, if you are losing too much weight too quickly, even if you're dealing with obesity or overweight, then that can also harm your fertility and reduce your egg reserve, because rapid weight loss is not a really good solution to weight loss for anybody. Of course, if you're taking GLP-1 agonists for aesthetic purposes and to remain really lean, having too low of body fat percentage can make pregnancy a lot more difficult. And so you are more likely to start dealing with infertility issues if you're taking this medication erroneously. I do think it's pretty rare. The majority of my patients who are taking it are taking such low doses that they still have pretty good body fat percentage. They're not overly lean. Of course, the biggest concern is if you are getting too lean on medications like Ozempic, then you're also losing a significant amount of skeletal muscle. So your lean mass, that is what keeps your metabolism up throughout your life. You don't want to lose muscle mass. You want to keep building muscle. You need that strength for functionality, not just during pregnancy and postpartum and to carry your children once you have them, but also for longevity. The amount of muscle mass that you carry is incredibly important for overall health, as well as just your metabolic health as well.
As a fertility doctor, one of the things that people don't realize is that I'm caring for up to 3 patients at one time. The potential egg source, the mother, the sperm source, the father, and the unborn, the fetus. To date, we don't actually know the impact of GLP-1s on sperm parameters. We know that losing weight will improve sperm parameters, but we also know that extreme weight loss can cause abnormal semen parameters. In fact, in women, we know that weight loss can help improve fertility, but we also know that extreme weight loss can hurt someone's fertility. And we don't know the effect of GLP-1s on fetal development. So as such, as the custodian of care for these 3 patients, who all have one common goal, which is one healthy baby at a time, I tell people that GLP-1s show a lot of promise, but they're not the panacea for infertility, and when it's all said and done, we should still follow the academic literature for helping people who want to get pregnant to use medications that are both evidence-based and rooted in science.